The ideal implant candidate should be someone who understands the whole sequence of the treatment, someone aware of their oral hygiene, and also aware of the function of what the implant can eventually do in terms of restoring the tooth that's missing. The ideal candidate would be someone that doesn't smoke, someone that does have fair to good oral hygiene, that can deal with the healing process of the dental placement and surgery. The sequence of acquiring a dental implant or dental implants would be initially the consultation where we review patient's medical history, we review the indication for the implant, we look at the anatomical landmarks as well as how much bone we have to work with. In some instances, sinus lifts are indicated, some indications for bone grafting may be required, but we look at all those things during the initial consultation. We gather information such as impressions. In my office, we have a digital impression as opposed to the old school way or methodology of doing it. And then we also treatment plan the actual size of the implant that we use in those specific areas. The technology that we have is cutting edge. We have a 3D X-ray imaging in addition to our digital impression that we can work cohesively to come up with our treatment plan prior to the surgery. So the advantage of that is, number one, it eliminates all of the time spent in intra-op or during the surgery. And then secondly, we're able to get the optimal outcome that we're looking to get prior to the treatment plan. With the technology and with the various types of implants that can be placed, we evaluate the patient individually as well as the anatomy, and then based on the size of the implant that we determine is adequate for that specific area, then we move forward with placing that size implant prior to the surgery. The advantage we have as far as digital treatment planning, we can do all that virtually prior to going to the operating room. Typically when patients come in for implant treatment planning, first of all, you have to look at the area where the teeth are missing. Either one, have they had the extractions prior to, or if there's an instance where we have to do the extractions and then wait for the area to heal, we have to wait several weeks before you can look to place the implant. In some instances, very rare, but in some instances you can do what's called an immediate implant, where if the extraction site is preserved, you have adequate bony walls and all the different dimensions, we can basically plan to do an immediate implant. We would then look to discuss that option prior to in terms of acquiring the dental imaging, the virtual imaging, and the digital imaging prior to the procedure.